Well, I believe today, Mr. Speaker, that the Assembly has gained something you've wanted for some time. And that's, I believe you can actually hear a pin drop in this room right now. It's my understanding that a few members would like to know my thoughts on this bill. In last year's vote, I did not support the bill. My personal life aside, I believe that we can do a better job managing pain for those with severe medical conditions. And that is why this year I will not only be supporting this bill, but I will be a co-sponsor of the bill as well. Last year was a very, I'll stand as an aside, this is a speech that I wanted to give last year. But as a newbie in a representative republic, this vote was the only one that I had a great deal of difficulty with because of my perception that there was a divergence between the wishes of my district and my core beliefs. After the vote, I spoke about this with my wife and family for weeks, before and after. And after the vote, I continued to seek the input of my constituents and experts on the matter, nationwide. In my district, I was forced to listen to some heartbreaking stories from people in my district who had loved ones who were forced to live in unimaginable pain. From experts, I learned that many ways that cannabinoid treatment can help assuage many ailments that current medicine does not effectively treat. As a veterinarian, as a healthcare provider, albeit for our four-legged friends, our winged buddies, and even those slithering companions of ours, I will tell you that the most frequently asked question that I have is, "Doc, is my pet in pain?" So I'm well aware, even at my level, of the importance of pain management. At this point, I believe that New York should join the other 18 states and Washington, D.C. in making the cannabis legal on a medical basis. On a personal note, my mother suffers from a severe degenerative condition in her spine. Try to picture this. Her spine has collapsed to the point where her last rib is now touching the top of her hip. She is in intractable pain. 4 separate surgeries and 2 metal rods currently run through the length of her spine. Over the course of this past year, her condition has continued to deteriorate at an alarming rate. Oxycodone, Lyrica, Neurontin, Percocet, and Ambien, all in massive doses, continue to fail to mitigate my mother's relentless pain. All of these pharmaceuticals are legal and protected by the pharmaceutical industry lobbies. Some of the side effects that we see from the drugs that I have just spoken of, oxycodone, Lyrica, Neurontin, Percocet, Ambien, here are some of their side effects that they allow us to know about. Psychotic behavior, suicidal thoughts, liver failure, the destruction of the immune system, and death by overdose. There is no good reason why we should continue to prevent a viable medication from being used in our state, and that is why I'm supporting this bill. We cannot ignore the reality that cannabis has real medicinal properties anymore, and to be perfectly clear, this bill will not legalize the type of behavior one would imagine in a Cheech and Chong movie. Rather, this bill takes responsible steps in helping those who are clearly in need. Study after study clearly shows that cannabinoid botanical medicine aids in the treatment of intractable visceral pain from cancer, unstoppable neuropathic pain from spinal disorders, and advanced stage neuropathy, asthma, glaucoma, and spasticity in multiple sclerosis, weight loss in various wasting syndromes, and emesis, throwing up, in chemotherapy patients. They are also studying it right now as an adjunct to diabetic treatment, and that's an ongoing study that's going on right now. As a healthcare provider and a state legislator, I believe that we have an obligation to employ every weapon in the pharmaceutical armamentarium available to help those with indomitable pain. Moreover, I believe that the misrepresentation of medicinal value of cannabinoids as they pertain to health protection or treatment is a great injustice to those currently suffering from horrible ailments that would benefit from this treatment. Even if the condition is incurable, we owe it to those afflicted to use every means available to alleviate pain. After working across the aisle on this issue with Assemblyman Gottfried and with experts from around the world, I believe that we have created a model that other states would be proud to follow. To my conservative colleagues who find fault with my decision to vote this way, I want to say that I understand. Marijuana, as we currently know it, is not a cure for any illness, and prescribing it to patients may not prolong anyone's life. However, like many pain medications, it has been shown to make the lives of those with some horrible afflictions, like my mother, better. To those who with doubts about the medicinal benefits of a controlled substance, I would ask you to look at some of the research and trust the 600 doctors and counting in the New York Physicians for Compassionate Care that would endorse using medical cannabis to alleviate pain. This bill ensures responsible supervision for cultivation, distribution, and use. If healthcare providers believe that medicinal cannabis is the appropriate medicine for those in pain, our government has no business in interfering with that relationship. For those in intractable pain and needing help, I will be your champion. I stand before you today, and I want to urge all of you to vote for what is right. I want to reassure you that we have crafted a good bill. Is it perfect? Of course not. But what bill coming out of this House or this legislative body or anywhere is perfect? But it is the product of bipartisan discussions, and I want to thank Mr. Gottfried for keeping an open mind on the changes that we made. We will be on the right side of history in voting for this, and we will improve the lives of those who are suffering. If we vote against this bill, we are voting against those with intractable pain, making them criminals no less. I, for one, will not make that mistake twice. Thank you.